Thank you so much again, everyone, for joining us. I'm going to jump right into the presentation, which is about 10 or 11 slides, reviewing where we stand for our current re-entry plan for the Long Hill Township Schools this fall. I'll leave ample time at the end of the presentation for question and answer, but I don't want you to feel like you have to wait until then to ask a question. If you have a question about a slide, or if there's something that I say that's unclear, please just pop right in and ask those questions as we go along. So again, welcome. 79 participants here. That's great. It shows the tremendous excitement that we have for the opening of school and the way that the community always works together to make sure everyone's on the same page and we're doing the best for our students. So I'm going to share my screen. And if you could just give me a thumbs up if you can see the screen okay, just so I know we're all looking at the same thing. Thank you very much. And there's more people in the waiting room. And here we go. I'll just let a few more people in. Apologies. Okay, so welcome to our plan for the safe return to in-person instruction for the fall. And this is exactly where we want to be, seeing our students engaged in learning together, working through chess and being shoulder to shoulder in the classroom, but without masks. We're not quite there yet. So what does it look like for us for the fall? I wanted to take a moment and just begin by saying that we have come a long way. It's been a demoralizing sometimes. And the last couple of weeks, we've had some news about spiking cases. So I thought, let's just begin by thinking how much better off we are this year than we were last year. So I want to begin just by comparing where we were last year, where we are this year, some of the things that we can helpfully leave behind. So early dismissals, those crushed days where we're leaving at the early part of the day and then we have to rush home and have lunch and have a remote afternoon, that is not our plan for the fall at all. We're looking to have full in-person instruction days with lunch service, and we've worked diligently to hire some additional to be able to absolutely space our students with no more than 3 at a lunch table at Millington School, with great spacing at Central School for lunch service. And when we looked at Gillette School and the numbers that we have had there, we made a decision that the best way to keep the students distanced and safe was to allow them to have their lunch in the classroom at their desks. So that's what's going to need to happen in Gillette, partially for social distancing issues, but also because we are using the all-purpose room for additional instructional spaces. So we really have some of our therapy areas in there, and we need to be able to keep that as a location when we're trying to maximize the social distancing of our students. So last year, through most of the year, it was masks all the time. And now this year, our provision from the governor is that masks will be required on the bus and indoors. But we will never require the students to wear masks when they're out of doors. And we have developed a schedule recognizing that the school days are going to be longer, which will include more mask breaks during the school day. So longer day means more mask breaks. The original recommendation for schools last year was to try and keep students 6 feet apart as an optimal social distancing. This year, the revised guidelines are 3 feet is optimal, and we have achieved that in close to all. There's some areas in Central Middle School where we can't say that every seat is 3 feet apart. And we also have to recognize that we're dealing with real people in classrooms, and these are students that are going to be working together, talking together and reading, and that they may, of course, when they're working in the classroom, get excited, stand up, walk around, participate with each other in a learning activity. So 3 feet is optimal. We try to achieve it at all times, but obviously any social distancing can't be completely perfect throughout the day. We're beginning to learn about the virus and how to manage it in quarantines. We faced a lot of extensive quarantines and remote periods. This year, we've developed several protocols to make sure that our quarantines are more targeted, making sure we have clear understanding of where students are seated, using information on the buses, for example, to have the buses divided into thirds, identifying who was close contacts in each section of the bus. We've carefully routed the buses to make sure that students who are riding the bus together are on the bus for the most efficient and direct way, again, limiting the time of exposure and limiting the chance that there could be a quarantine resulting just from students, since the students would be able to not have to quarantine just because of that ride for the bus. There is a question, kindergarten, since the students are new and don't know each other, will they have outdoor time and be able to meet their new friends and see each other's faces? I mean, one of the things that has really impressed me since being here in Long Hill is how much time the students spend learning out of doors. So the answer to the question is yes. And if you drive around the schools, you'll notice a couple of things. For example, the courtyard here at Gillette that is used by kindergarten students, that's behind my window. We had the landscapers here yesterday. We were trimming everything back. We were making sure that it was safe without some of those dead branches that had been there coming down. And that's an area where the kindergarten students, which makes my day, are often outside having snack together during the day, doing a learning activity, having their social emotional learning time. So yes, we are planning to take advantage of the weather as much as we can, have the students out of doors as much as we can, and get them to, yes, see each other's faces and appreciate learning one another's faces and making friends. In the past, we had directives where we were having no large gathering, no field trips, no parties. So we wanted to say, what are some of the things that people look forward to in the fall, and how can we plan for those? So first of all, we've established all of our back to school nights. They'll be sent out to you from each of the principals tomorrow. And we've tried to combine the best of both worlds, which is asking that the principals and the folks who make those presentations to the large groups at the beginning of back to school night record it and send it home to you in advance. And then you will have the opportunity to come in and to meet your child's teachers, to meet the other parents in your child's class, and start making those connections as well. One of the things that is a great tradition here in Long Hill is the Halloween parade. So our goal is to be able to return to that Halloween parade for this Halloween, but maybe things like the class parties that would follow a Halloween parade won't resume until January. So one of the things that I wanted to just review is that, yes, we do have volunteers who are going to be in the school, for example, to help us with PTO lunches, but we're planning to phase back to the more and more volunteers coming in come January and have those parties and so forth. A question was, as you're looking at early dismissals and full in-person days without lunch, is the person correct in assuming that we don't have a remote option? And that answer is yes, there is no remote option for instruction this year. Our option is full in-person days, 5 days a week for all students. Question about quarantines. I do have a slide on quarantines, so I'm going to ask you just to be patient with me till I get to that slide. And if I don't fully answer your question at that time, if you could just put it back to me, I'll go through it in more detail. I'm also checking the chat. Are food days planned to return? Yes, foods are planned to return, and we've met with the Home and School Association, PTO, and they're looking to begin those at the typical time, late September, early October. One day at Gillette, 2 or 3 days at Millington, I couldn't remember which one, and then the 4 options of days at Central. Will teachers and others be allowed in Millington School required to be vaccinated? We will not be monitoring the vaccination status of our volunteers, but we will be maintaining a record of the limited numbers of volunteers that are here for contact tracing, as we always do. And we will also require that the individuals who are volunteering have masks on. And the PTO has developed a COVID protocol for anyone who is serving food, including wearing gloves, social distancing, and they will be maintaining those as well. Is there a remote option for student? I'm going to go over the remote options, and I think what I'm going to do is just check back with the chat after I get a few more slides, because some of the questions that are coming up is what we are going to be going through. Oops. Apologies. Okay, now my clicker is working. So one of the questions was looking at that statement about masks. We've had a lot of discussions about it and what does the new governor's mandate mean? So I took a moment to kind of clarify that, and this is drawn from the governor's executive order 271, and it's addressing specifically what are the accommodations for those with special needs. So for individuals with special needs, we absolutely apply the standard that we offer compensatory educational services when they're needed. So if there was something that we learned where a child was not progressing and needed additional educational services, we would provide those, and that is done on a case-by-case basis. The second question was related to mask wearing and accommodations for those with special needs. So there is a possibility to have exemptions from the indoor mask mandate, and they're pretty clearly defined, and I've color coded them in 2 ways. First, the items in black. So these are things that the school monitors every day. So we would say that students wouldn't wear masks indoors under the first condition if the individual was exposed to extreme heat. We have invested a tremendous amount of money this year in ensuring that every HVAC unit has a clean filter. We've purchased purifiers. We've installed 130 new windows district-wide with screens for the fresh circulation of air. And we've undergone extensive repairs of air conditioning systems. It's been an ongoing project all summer, and we are tremendously fortunate to have great improvements in that area. So each of the building administrators and myself will be monitoring the temperature in the building classrooms before the students arrive and making sure that they're comfortable. If there are unforeseen circumstances and a classroom is extremely hot and we can't relocate it, then that of course would be a time that we would not require the students to remain masked if the heat was so oppressive. Obviously, if we saw a child who was having difficulty breathing, we would immediately remove their mask. If we were engaging in a physical activity where the children were very active and wearing a mask would cause them danger, we would never require that, and we would allow them, of course, to remove them. For physical education classes, high intensity activities, if we're not in well ventilated areas, we're going to make sure that the children remove those masks and remain safe, and that their ability to breathe clean, fresh air that is not oppressively hot is what we're working towards every single day. Obviously, if a child was using a particular piece of equipment or executing a task where wearing a mask would be unsafe, we wouldn't let that happen either. Now, the white is where the parent responsibility comes in. So if a child has a documented medical condition that precludes the child from wearing a face mask, the parents would contact their physician and have a medical note written to give to the school's nurse. And then the nurse would send it to our district physician. I've had one or two people ask me, well, if I know my child has a medical condition and I send in a note, why does the school physician also have to review that medical note? So I just wanted to clarify that the school physician isn't reviewing the medical note to make a determination of whether or not he agrees with your doctor's diagnosis. Rather, your doctor is giving you a recommendation for your child based on their health conditions. The job of the district physician is to think about all of the children in the district. So when he's presented with a request for a student not to wear a mask, he has a conversation with the school nurse and asks a number of questions, such as, are there any other children in that class who are already exempt from wearing masks? Are there any children in that class who are medically fragile? How many students are in that classroom? What is the nature of activity in that classroom? Meaning, are these 4-year-olds who are moving around a lot, or is this a middle school where students are largely in rows or working in groups together often? And he'll ask those questions, and then he might give us additional recommendations based on what he learns about the classroom. So for example, the district physician would have that conversation, review the information, and then he might say, okay, I think it sounds appropriate, but my suggestion would be that the child who is unmasked have a shield up around their classroom because the proximity of students are so close. Or he might ask a question like, well, if you have that many students in that particular class, can you do something with this medically fragile student? You know what I think you're going to have to do? You might have to contact that parent, and without violating any, privacy concerns, we might be obligated to call the parents of medically fragile students in the classroom and say, we have a student who's in your child's class that we want to let you know is going to not be masked, and let them know that situation in the classroom has changed, because that might impact the way they feel about the education for their child. So I hope that addresses some of those questions. So the components to the Safe Return to School plan are threefold. First, all of the health and safety. We have, each classroom has wipes, it has the cleanser and paper towels. We have hand sanitizer. We have signs posted around the building reminding individuals about appropriate hand washing and respiratory etiquette. There are points in the school day where we stop, we take a break, we require that the children wash their hands. We have had healthy facilities checks from our insurance underwriters, from our playground safety specialists. All of our nurses are trained in contact tracing and work closely with the Bernards Department of Health on that. You've received a number of emails identifying the testing and vaccination sites in the area. They're also posted to our website. So those are the areas that we work on health and safety. In terms of ensuring continuity of service, we have identified students that we feel might have experienced COVID-related learning loss. We offered those students a summer institute course. We are increasing the social and emotional and mental health supports that we have in the building by bringing in outside resources and whether it be nursing or social work services that are coming into the district to support our mental health team. And this year, you'll be receiving notes from me and each of the principals about a number of learning acceleration activities that we are adding through the New Jersey Consortium of Gifted and Talented. Finally, the third area of the plan is public comment. That our stakeholders, our teachers, our parents, our students must be able to talk to us about what they think about our reentry plan. And if we change everything, a public input period must be offered. And that was interesting because our plan said that we would conform with the guidelines. And then there was a large request from the community to want to know how people felt about the mask wearing mandate or non-mandate as it would have been from the governor. So for those reasons, we decided to administer a survey, and I'm going to share those survey results with you now. So there was a possible 1,100 individuals who could have replied to the survey. And the numbers came out very strong in terms of participation and as we would have expected. So I'll give you a second to look at those. We have a new feature that allows members of the community to receive emails and information about what's happening in our schools. And on topics like this, I send those emails to individuals who've opted into our school email system. We increased the cost of busing this year, so I did want to know a little bit more about busing and the subscription cost, which went up to $900. The cost of transportation has gone up and the routes efficiency and all of the work that we have to do to maintain the routes, generate them on the paperwork side and do all of that requires a large portion of an individual's workday here in central office. So I wanted to just get a sense of how people were feeling about that rate increase. So we were anticipating that we would have 63 students or so who would subscribe to busing. In other words, people that live close enough to the schools that they don't qualify for free busing, but they could pay for the subscription service. And right now we have about 54. So a little less than we anticipated, and some indicated in this survey that pricing was a major reason. We're looking at our before and after care, and I just wanted to get a sense if people's needs in the district were changing based on coming back from the very restrictive COVID year. You know, you had many people who were working at home and they might not have needed the before and after care services. So I just wanted to see if those numbers were increasing. And actually, based on this data, those numbers too are down a little bit. So we gave a number of options in compliance with what we were looking at for the CDC guidelines. So I'll give you a minute to look at those. The largest percentage at 29.6% is the blue. And that was that masks should be optional for all students. 19.2% said masks should be optional for all fully vaccinated individuals. This number over here is about, I think, 14%. I can double check that. That's saying that it should be optional just at the middle school. The rationale being that people at that school are of vaccination age. Then 20.8% saying that masks should be required for all students, staff, and employees in the district. And then 19% saying that masks should be optional if the local numbers are in the low or moderate range. The remaining percentage, and as you can see, it's a little less than 10%, but they were really delving into specific nuances of the masking requirement, how it could be flexible, how we might look at it for different grades, how we might look at it in different situations in the classroom. And those other responses really came in that way. We looked at this question and we have made a determination that while the majority of the people feel that their children can eat lunch in the cafeteria, and remember we asked this question because when children are eating lunch, they're unmasked. Or if they'd like to have their child eat in a smaller environment than the cafeteria at Millington and Central or in their classroom at Gillette. So if you fall into this category that you prefer not to use the cafeteria for your child, in each of the buildings, we have an alternate site set up for lunch service, which will have less numbers of students. And if that's something that interests you, I would ask that you please write to your building principal and make that request so that we can accommodate you. There were additional comments and I grouped them related to categories. So 23 of the comments spoke about no masks or masks being optional. 20 talked about masks being required. 12 matched and tracked with the other comments on the mask question, and they dealt with mask guidelines should be more flexible, kind of evolving and thoughtful. Number 8 people rather talked about quarantine procedures being revised, and 7 people asked that we have the remote option or at least remote options in the afternoon available for students. There were a number of questions about cleaning protocols, which will continue the same way they were last year. So the electrostatic BioS sprayers will be used on all playgrounds, touch points such as doorknobs, bathrooms, areas in the hallway where students are frequently will be cleaned during the day. With regard to mental health issues, we've been thinking about this so much. We have welcome committees at each school that'll be working with students who are new and coming back for the first time since remote instruction began in March of 20. We had a lot of questions about moving more learning outdoors. While we will be having outdoor learning opportunities, some of the discussion that we had is if you took an hour block of instructional time and you were in the classroom with the smart board, with the students focused and seated at their desks, and they worked very hard and they accomplished the goals, you might achieve more having a 45-minute concentrated lesson indoors and then taking the students outdoors for 15 minutes afterwards in that same block of time, just giving them that additional break, the exercise, rather than trying to move the entire lesson outside where the students may be more distracted by the butterflies and the animals, running through the fields outside. So that's something that we are looking at and will continue to monitor. And then there was also questions about monitoring the vaccination, COVID testing. One person asked about the use of lockers at the middle school. And I believe that the intention, and we'll go through that at the 6th grade orientation for those of you who are new, is that they're beginning the year as we ended with not using lockers right away and then assessing the needs of the students because they seemed pretty flexible, not having those lockers. And you might say, what difference does lockers make, whether they use them or not? It's just more time for the students to be very close together in the passing time. The lockers are on top of each other. It keeps people in an unstructured environment more and in a time where they are less supervised and might be taking their own mask break. So we really just weren't using lockers just to keep the students moving closely from classroom to classroom and avoiding too much unstructured time for contact. So one of the things we've really been struggling with, and I've been thinking a lot about this summer, is when you have a presumed positive case due to COVID symptoms. So all of us know our own children. We know if we have a child that runs with a high fever, no matter what they're facing. We know children who have allergies. So I wanted to take some time to walk this through with everybody. If a child presents with COVID compatible symptoms, even if it's not COVID, there may be a chance that that child will be excluded from school because they are a presumed positive COVID case. So I just want to explain what could trigger that and how do we address those people who have chronic health conditions. So if a student has two of the following symptoms in the first list, that fever and chills, or the runny nose and the nausea, and two of those symptoms are also not just flu symptoms, but COVID symptoms. If they present with those, we would treat the student as a presumed positive COVID case. If they have one of the respiratory indicators of COVID, that persistent cough, the difficulty breathing, shortness of breath, the loss of taste or smell, those are strong indicators of COVID, and that alone might cause us to treat a child or a staff member as a presumed positive COVID case. So you might say, my child has Crohn's disease, my child has chronic allergies, my child has asthma. And for any of those reasons, when you look at this list, you might say, well, my child is a presumed positive COVID case at any day of the week. What we would like to do there is to look specifically at that child and only push the child or the staff member into that presumed case if this was a new occurrence, if it wasn't something that was consistent with their allergies or chronic disease, or if their physician says, you know what, this patient that I'm treating is asthmatic, but when I look at their baseline, I'm seeing something a little bit more than asthma behaviors that I've seen from this person in the past. So the school nurses do want to work with you to, if your child falls into this category, to make sure that we're not unnecessarily putting them in the case with the presumed positive for COVID due to symptoms. And we might need to have a conversation with your family doctor just to confirm that. So quarantine. Let's just start by saying we don't want to quarantine. We want to keep everybody in school and safe, but we do have to consider what might trigger a quarantine and how, in an era where now vaccinations are available, quarantines may look different. So based on CDC and the Bernards Department of Health, if an individual has those COVID compatible symptoms that we just discussed, or if they've been in close contact with an individual who tests positive for COVID, then they can fall into one of basically two categories. So if you're fully vaccinated, but you're not showing symptoms, you do not have a need to quarantine. Test on days 3 to 5 and wear a mask indoors for at least 14 days or until a negative PCR test. Fully vaccinated individuals with symptoms are going to be treated for quarantine in the same way as unvaccinated individuals, which is a quarantine for 14 days after the last contact with the individual, a test on day 5 or later. And we can reduce the quarantine length from 14 days to 10 days with a negative PCR test. Now, in each of these cases with the quarantine guidelines, you'll notice that we require the PCR test, not the rapid test. And those are readily available at CVS and the local pharmacies, but it is that PCR test that we'll need for the return to school. Again, a close contact is anyone who has been within 6 feet for a cumulative period of 15 minutes over a 24-hour period. And again, just to emphasize, and it may seem counterintuitive that there's so much conversation about masks, but masks do not change what the quarantine or close contact guidelines are. So, and all of this I just confirmed with the CDC and Bernard's Department of Health this week. So I say that this is our most current guidance today, understanding that that may change over time. Again, our goal is to keep all students safe and to keep all students and in their classes, keep the schools open, keep everyone healthy with those full schedules. But if we do come up against quarantines, we have to think about how are we going to educate these students. So what happens if a faculty or staff member has to quarantine? So the district is not offering an opt-in option for remote instruction. So we expect everybody to be here every day for the full day. If a student, faculty, or staff member has been directed by the district to quarantine for COVID-related reasons, the district will provide remote access to the student or work access to the employee. So I just want to clarify here, if you want to look at this broadcast actually came up yesterday because this has been a big question among school districts, and you can read the full details of it there. So one of the things that folks were saying was it's such a challenge for teachers, and I know the teachers on the call can attest, to do that hybrid teaching, to teach with the classroom in front of you and then the students on the screen. And parents who've watched that know what a tremendous difficult task it is. So we have been looking at all different types of things. Can we just offer home instruction, for example, to an individual who has to quarantine? And that's not going to work for a number of reasons. First of all, if someone is home because they're ill, you can't send a tutor into their home. The second thing we talked about was, well, can we establish certain pockets that would be for remote instruction? And the answer is, while we hope everybody is safe and remains in school, we don't know which classrooms, which grade levels might have to quarantine. So the reality is that if the district needs to quarantine a student, faculty, or staff member, that area where that child is, be it a third grade classroom or 5 different sixth grade classrooms, for the time that that child or staff member is quarantining for COVID, will have to operate with the hybrid model. I'm sorry, I know it's not ideal, and my fingers are crossed and hopeful that we don't have to do it. Now, understand that if your child ends up in a situation where they're affected by quarantine and they want to get remote, then they will get remote instruction from the district. We may be beginning that just when we first get the student and the information with just Google Classroom assignments, and then transition as quickly as we can to the Zoom link. But sometimes what happens is we find out about the case later in the day or after school has dismissed. And then we need to meet with the teacher. We need to make sure that they're ready to go and have their materials ready. So there might be a slight lag time. It might not be instantaneous to get that live Zoom link up to you, but we will endeavor to do it as quickly as we can. Absences due to travel and the resulting quarantine that affects travel will not be afforded remote instruction, and those guidelines can be found here. So the main thing to take away from this slide is we are not offering remote instruction. We want everyone here 5 days a week for full time. We do not want people to take vacation when school is in session and believe that there will be a remote option available for them, because there simply won't. The only remote instruction that will be available is when the district identifies that we have a COVID-related quarantine. And again, both of these slides will be, both of these information that supports what I've said to you, you can read in the broadcast from the Department of Education and from the travel guidelines. And I'm going to post this slide presentation after we get off the line today, and you can spend some time reading through those so you can have more detail yourself. I'm going to stop sharing the screen, and I have to actually back up into the chat because it was a little challenging to go from the chat to the questions. So I'm going to begin with the questions in the chat. So I'll just scroll back. I think I did answer that food days are planned to return in late September or October. Next question is, if the students will be masked on the bus, why would they be considered a close contact? So students are masked on the bus, and it's rare that we should have a bus quarantine. So what would need to happen on the bus would be sitting next to each other for more than 15 minutes. And we've worked hard on our routes to make sure that we don't have groups of students that are together next to each other for more than 15 minutes. So that's what would result in a bus quarantine. And also, I just want to point out that that question went up before I put the slide up. And I have, I've asked myself that question many times as well. If the students are wearing masks, why doesn't that negate close contact? And the answer that I've been given is that the masks are a mitigating factor, but that they do not actually change the concept of possible exposure through close contact. Next question is, will teachers and others allowed in the Millington School be required to be vaccinated? We did not require that teachers be vaccinated. We do know, what we did do was that if teachers and faculty and staff members wanted to share their vaccination status with the school nurse, they could do so, because I wanted to be sure that they were reimbursed the sick time for those vaccination dates. I don't know in the district who is vaccinated and who is not, only the school nurse knows that. But I did ask for some general ideas of numbers, and district-wide, over 85% of our faculty and staff are fully vaccinated. I will not also monitor the vaccination status of individuals who come into the building, but I will require that they sign in, wear masks, and follow the guidelines. The next question in the chat before we go, there is no remote option. That was a question. So another question is a little bit more detailed. Is there a remote option for students who are not well, but it's not COVID? So and I look at the second part of your question and I see where you're coming from. The question is, that way, even kids with a common cold can be kept home. And I do understand that. I understand the rationale for the question, but unfortunately, right now the answer is no. The only remote option will be for those who are quarantining because of exposure to COVID. And we would hope that if your child is unwell for other reasons, that they just rest up, stay off screens, and get healthy and come back to school when they are healthy. Will teachers need to be vaccinated? That question came up again. Sorry, I answered that one already. Would you continue to be offering a remote option for back to school night? There's no reason the teacher can't Zoom his or her presentation simultaneously. I don't love being in a small room with multiple adults whose vaccination status is unknown. That's an interesting point. Because when we came up with the idea for back to school night and we said, all right, let's think about what we can do on our end. We said, we're not going to do the big presentation in the beginning. We'll try and limit the number. We'll try and stagger the grades. But we didn't actually ask that part about the classroom presentations. So the short answer to that is I can't answer that now, but I'll bring it back to the team before we finalize the plans for back to school night so that they can get feedback from the teachers and the principals. And the answer for that is going to be forthcoming. I'm just writing a note to myself. Give me 1 second. Okay, the next question in the chat is, what about individual speech therapy sessions great that I'm speaking like this because the question is where the focus is on articulation. So sorry, I'm tongue-tied on the question. Will the therapist wear a clear shield and will the child be able to take the mask off for the therapy session? So I've actually observed a good number of our therapy sessions to get a handle on how this is done. And our therapists do wear the clear shield. And I have noticed that they have set up the therapy room in such a way that when they're working on articulation, this child is directed to take their masks down. I've been amazed by the quality of the therapist's lessons during this challenging time. But for real details on that, I think what you really want to know when you're asking a question like that isn't just what does the speech therapist room look like, but how can I work on this? How can I support this at home? So, you have all the time as well with your child at home when they're not masked and when you're doing things together. So I encourage you to reach out directly to the therapist, get the clear sense of what's going on in the session, but then also have them review with you and what can I do to practice this behavior and help my child's articulation issue when they're at home. Confused, someone is confused by the wear the mask when indoors for 14 days or until a negative. Yes, absolutely. So I understand why that's a confusing question. The question is about this, why you might be confused by the way I presented the slide. I took the vaccination guidelines directly from the Bernards Department of Health and the CDC. And what that said was that a vaccinated individual who was symptomatic should mask up indoors for 14 days. Obviously, that would always apply in schools, but I thought it was important to share the whole directive because what that also means, just for all of us who are adults, right, where we might be vaccinated, but then we might be exposed and symptomatic. We shouldn't just be masking up when we're in school if that happens to us. We should be masking up at the grocery store. We should be masking up at home if we're living with people who are unvaccinated, and it should extend everywhere, not just school. So sorry for the confusion, but that's why I added that piece of information. Are there quarantine guidelines for students who need to travel out of state? Well, I'm unclear why someone would need to travel out of state. That sounds like a very individual question. You can review the travel quarantine guidelines on that link that I provided. And again, I provided the link instead of getting too much into detail in it because it seems like every day the travel guidelines are changing. Something else is being added to the list of places that you have to quarantine for. So that question is going to depend on who, where, when, what time, why. So I would encourage you to reach out to the school nurse and to consult that website and see what applies to the particular situation. Oh, good point. Can I just put the URLs in the chat? Yeah, I guess I could do that. That would be smart. And I should have thought about that ahead of time. Before I close the questions, I'll copy the URLs in the chat. If the child has to quarantine because of a family member quarantine outside of school, will they be given remote access? And what is the guideline for siblings in the same school or different school? So of course, that's all about communication with the school, identifying the exposure to COVID, and then confirming that with the school. And then the school would say, yes, you do need to quarantine and we'll assist you with getting remote instruction for this COVID related exposure. What are food days? This is relevant for kindergarten. Oh, thanks. Yes, so food days are sponsored by the PTO using a website. I think it might actually be called Food Days, where you can log in and pre-order your child's lunch. And it's an opportunity for you to take a day off of packing a lunch for your child. The children like it, but not everybody participates. They become more involved as the children get older. There's only, I think we do pizza day here at Gillette, and then a couple of days at Millington, and then 4 days over at Central. And the wonderful thing about it is if you choose to participate, it is a fundraiser for the PTO. And any money that is made from the food days goes directly to do things like buy things for teachers' classrooms with teacher grants, or purchase equipment for the school that falls outside of the budget of the school, typical school budget. Is there a remote option for, oh, sorry, that was the same question. If a child is on family vacation the last week of summer, will they need to miss the first week of school? Well, I don't know if that entails travel quarantine, so that would be really particular to what you were doing during the last week of summer. If my child teacher needs to quarantine, will the teacher do all the instruction remotely, or will there be a substitute while the teacher is in quarantine, or some mix? So the teachers will be able, it all depends on how the teacher is feeling. So if a teacher is quarantining and they're not well, obviously they wouldn't be able to teach. If a teacher is quarantining and they are able to teach, of course, we would have them teaching remotely, but we would always have another individual in the classroom with the students. So there it is a mix in the sense that you have to physically have someone in the classroom with the students. But if the teacher is not available to be there for a COVID related reason, we're not going to exclude the students from school if they're safe to come in. So we will get them educated in the classroom in person in the best way we can. If the governor or the state allows for a remote option due to the number of cases in the state, will the district make a virtual learning option available? Yes, we will. Just as right now, we don't have a remote option available because we're not allowed to do so. If we were told that we were allowed to do so, we would. And I do want to speak to those people who have been remote for very important reasons. I've enjoyed learning more about your reasons, the families, why people are choose remote instruction. And I find it very compelling. I just want to tell you that best that I can do is, since we're not offering remote instruction, I can just keep it as safe and clean as we can to try and keep everybody here and happy. And I hope you will feel comfortable coming back to school. And I hope we don't have to offer virtual learning again and that everyone stays safe. But if that option comes up for us, we would indeed do it because it reflects our community. We have 10% of our student population that were fully remote through June of this year. Considering vaccinated individuals still contract, and transmit it to others, will vaccinated individuals have to quarantine at home as well for the 14 days? It depends on whether they're symptomatic or not. And next question is there a plan to institute wider remote learning in any instance if the state trigger? Yes, absolutely. We would, if we have to go to remote, although we sincerely hope we do not have to. I can't. I mean, this next question is a good one, and I can't speak about it in more detail. The question is, can you speak more to the quarantining in spite of wearing masks? We were just discussing this as an administrative team with the nurses yesterday, and none of us really have any answer. We're following the directive. So we have been directed by the CDC and the Department of Health that even if an individual is wearing a mask, once you make the determination that they're a close contact, they have to quarantine. And what they say when they give us the answer is that a mask is a mitigating factor, but it doesn't completely eliminate the possibility of contracting. So that's the reason for it. I'm sorry that that one's all I know on that. We are working hard that we will not be quarantining entire classes. We're going to use seating charts. We're going to look at classrooms in quadrants of 6-foot squares. We're going to limit the amount of time that children are passing one another in the hallways, releasing only groups at certain times. we did, it seemed that we narrowed down the amount of kids being quarantined towards the end of the year. Yes, we started some of these practices already and we are continuing to refine them. We had some quarantines that were a little larger than they needed to be. But again, you need data to make good decisions. How did we know that those quarantines were larger than they needed to be? Because no one got sick. And we were able to chart, okay, when we quarantined in this way, what happened? When we looked at the footprint of the classroom. So yes, I do know that there were at least three occasions last year where our quarantine numbers might have been a little high. And we're aiming not to do that, and we're using all the data that we have from our past quarantines to learn from seating charts. We're definitely going to be more targeted. Can you also speak about Chromebooks and technology? They're wonderful tools, but I'm hoping the kids can get back to some writing, paper and pen. There have been a lot of studies that have talked about how a breakdown that there's a certain fine motor skill that you develop only from writing. And even if you use your fine motor skills in another way, you're not making those neurological connections without paper and pen. So yes, we will be working that way. Chromebooks, just to give you a sense of what day-to-day work would look like. Chromebooks are only going home for 5th through 8th graders. So our focus then is then in pre-K through 4, the homework that's going to be sent home will be writing, paper, pen. There are some good news with every kind of pandemic. So you might remember that last year we got a number of new Chromebooks, hundreds in fact, for each of the grade levels. We just finished writing a connectivity grant, and it's going to allow us to get 70 new Chromebooks, and we'll be using those at Gillette School, but during the school day, and the homework will still be working with writing and cutting and paper and pen. Still have some more questions here in the chat. I decided to leave my child home because it's hard to wear a mask until the mask mandate will be off. How will the school reimburse me for all PT, OT, and ST services from my child? What form do I need to fill out? So it's not as simple as filling out a form. If you make a decision to disenroll your child, the decision to disenroll has different ramifications depending on why they're being disenrolled, where they're going to be enrolled. Are they going to be homeschooled? Are you going to be sending them to a charter school, to a private school? So what you would do is contact your school office, let them know of your intention to disenroll your child, and also what the decision is of where your child is going to be educated. And that would direct the answer to all of your other questions regarding whether or not the district is responsible for paying for services that you elect not to take in school. Are students allowed to use or wear common objects such as toys, games? Yes, so children would bring their own toys to play with last year. So that's a really good question in terms of shared supplies. One of the systems we had in place last year was in art room, for example, the students would sanitize and the desks would be washed before they sat down, and then they were able to go to the common area and share supplies. So with regard to how that would look in preschool, we're going to have to follow up on that question. Hypothetical question. Can you talk a bit about under what circumstances, if any, the district would be back in a situation where full-time in-person instruction would not be provided? So that's when we go into red. So if you look at the road forward plan, and I'll put that link in the chat as well. It identifies that there's only when we are in the red, which is the high transmission rate, must schools close and go to fully remote. So you look at the chart for the area, that's what happened last year or in March of 2020. And then they made some amendments. So They actually give you a chart. I'll put the link in so you can look at it. And in the chart, it says once these conditions exist, once you've hit this tipping point, schools need to close. So it's a high transmission rate. It's basically a big outbreak before schools would close again. Apologies if you already answered this, but would the whole bus be quarantined? No. So what we're doing is dividing the bus into 3 zones, front, middle, and back. And they would have to be a student sitting next to a student in the same zone for more than 15 minutes. All of our schools' buses also have cameras. So if we need to, we can check that on the camera, because sometimes you ask a student where they were sitting in the bus and they say, oh, I was sitting in the second row next to Susan. And then you look at Susan and say, so you were sitting next to Joe? And she said, no, I wasn't even in school today. I didn't ride the bus today. So sometimes their memory of where they were sitting might not be the best. And that's for all of us, because a bus ride is a monotonous thing. So you're trying to remember, where did I sit? How long was I there? So we use a general sense of what area of the bus students sat on, how long the ride was, and if we have to look at the camera, we do, but we will not be quarantining entire buses. Thank you for coming. When will the class list and supply list be shared with the parents, and how is the information distributed? So you can go on any particular school right now, and right on the homepage, you can jump to the supply list. Those have been up for a couple of weeks now. Individual teachers, may ask for additional things. So I know it is important for everybody to know who their class teacher is. Those are going out August 24th. And understand that if there's something beyond the supply list that's now posted, it's not as though it's going to be something that you would be expected to have on the first day of school. There are counties that are in the red now, aren't there? I would have to double check that. I think it is a statewide outbreak, but again, I'm going to put that link in to show you. Well, the kids have somehow normal school days inside. Yeah. I was thinking about this, and this came up so many times. And Mr. Rideout, I do hate to put you on the spot, but you know what a popular topic this is. The question is about in-person specials. So do you want to let people hear that directly from you?
Oh, hi. Hi, I'm Mr. Rideout, music teacher to the stars. As of now, we are planning at least Gillette and Millington that everyone is going to have their special live and in person. So parents don't have to hear us drone on a computer screen. And from that, I believe our policy is going to be hand sanitizer before you come in, hand sanitizer when you leave. We're going to be wiping everything down. And I think, is that good, Dr. Mucci?
Yes, that's perfect.
We're planning on doing it. Yes.
Yep. So we're back to in-person specials. And we are also distributing library books again. And the students are moving around the school during the day, and we're trying to keep things as normal as possible. Conditions going for full virtual, but at the end of the last year, I understand some schools were only still half-day in session with lunch at home and virtual. Oh, okay. So now the question is, okay, if we don't, this is a good question. These are good for me. So the question is, I understand some schools were still only in half day in person with lunch at home and virtual afternoons. What is the risk of ending up back in that situation? So my answer to that question is, we would need, and please, like, I even hate saying this out loud, but it would have to be evidence that we were transmitting during lunch service, right? And we're doing everything we can not to make that have that happen. That's why it took us so long to go to full day, because we had to order more tables, we had to create charts, we had to come up with plans for how we would do the food service and the food days. So we put a lot of plan and mitigation circumstances into being able to safely serve lunch. And the only way we would take that away or peel that back and do lunch at home and remote afternoons is if we failed, miserably there, or if the virus got out of control and we were actually had evidence that we were spreading COVID and traced it to lunch service. I hope that answers that question. If we decide to unenroll our children at the beginning of the school year, but later when the pandemic improves and we feel more comfortable, can we enroll them back? Even yes, you can enroll your child back any day. You don't have to wait for marking periods. You don't have to do any of that. We are a public school. We are here to serve you. There is no waiting period if you disenroll and come back. Somebody noted that right now New Jersey is in moderate. Right now, the whole state is yellow. When will we have information about the time for pickup and drop off? That should be in tomorrow's emails from the principals. And I put those links from the slide in the chat. Class lists are going to be available on the 24th. Will kids have any say with who they sit with at lunch? Sounds like assigned seating. Will multiple classes be outside together for recess, sorry. So students can have a choice with where they're sitting at lunch, as long as they remain in seats that are distanced. So we wouldn't allow the students to crowd in more just so that they have more of their friends to sit with, but we will allow them flexibility in where they're sitting, and then we will keep track of where they are sitting. Will multiple classes be outside together for recess? We'll have classes in different sections of the playground and keep track of who's out there when. We developed a really good system with that this year, rotating the outdoor areas that people were using at the same time. Will we have access to the school curriculum in case we need to decide to homeschool our children? Of course. So you always have access to the curriculum. If you go onto our webpage and you go to curriculum, you can connect to the district curriculum through Rubicon and look at the detailed curriculum for each grade. That is the questions that are in the chat for now. So I'll give a couple of minutes for people to either call out a question or type a question in the chat. And I'm also going to upload the information on the Road Forward plan. I think I have that on my desktop and I'll put it in the chat. Any other questions? Just give it another minute or two if anybody has questions. And I do want to let you know that we'll look into the back to school night and how we're going to handle sharing supplies in especially the younger grades like preschool. This last link that I'm putting in the chat has the chart that I was talking about. If you go on that webpage, yeah, if you go on that webpage that I put in the chat and you click on the first active link, it'll take you to the Road Forward document. And the chart that I was discussing is right in there. If you come up with another question that usually comes up right after you've had time for all this information to sink in, then you can feel free to send me an email or give me a call. We're all busy for the rest of the summer. I hope you've noticed some of the facilities improvements that we've been making to welcome you back. We're trying to make the outsides of the school as beautiful as everything that's going on in the inside of the school. I can't see the links in the chat. Okay, so did I just send them to some people? Is that what I did? It says to every, oh, sorry, I didn't mean to laugh. It said to everyone in the waiting room. So I just sent it to everybody in the waiting room instead of everybody in the meeting. So now I'll do it backwards. Thank you for noticing that because I have been in the wrong setting. I'm not quite as good as all the teachers at keeping everything, all these balls in the air at the same time. Thank you for letting me know because of course it shows up on my screen. I will send both now. Do you see them now? Just a thumbs up if you got it. Okay, thanks. Sorry about that. So the road forward and then the quarantine. Yeah. So if you need any other links, if you want to talk about anything further, please don't hesitate to give me a call. We started off with 95, so, and we're still at 74. So thanks for the strong participation, for working with us, for everybody to be on the same page and make a great school year for the students this summer. Enjoy your last few weeks and have a great rest of the day. Thank you very much for joining me.